Depression is a mood disorder that causes a persistent feeling of sadness and loss of interest. Also called major depressive disorder or clinical depression, it affects how you feel, think, and behave and can lead to a variety of emotional and physical problems. Depression is a common mental disorder. Globally, it is estimated that 5% of adults suffer from the disorder. It is characterized by persistent sadness and lack of interest or pleasure in previously rewarding or enjoyable activities. It can also disturb sleep and appetite. Tiredness and poor concentration are common. Depression is a leading cause of disability around the world and can dramatically affect a person's ability to function and live a rewarding life. The causes of depression include complex interactions between social, physiological, and biological factors. Life events such as childhood adversity, loss and unemployment contribute to and may catalyze the development of depression. Psychological and pharmacological treatments exist for depression. However, in low and middle income countries, treatment and support services for depression are often absent or underdeveloped. It is estimated that more than 75% of people suffering from mental disorders in these countries do not receive treatment. Common signs and symptoms of depression in children and teenagers are similar to those of adults, but there can be some differences. In younger children, symptoms of depression may include sadness, irritability, clinginess, worry, aches and pains, refusing to go to school or being underweight. In teens, symptoms may include sadness, irritability, feeling negative and worthless, anger, poor performance or poor attendance at school, feeling misunderstood and extremely sensitive, using recreational drugs or alcohol, eating or sleeping too much, self-harm, loss of interest in normal activities, and avoidance of social interaction. Depression is not a normal part of growing older, and it should never be taken lightly. Unfortunately, depression often goes undiagnosed and untreated in older adults, and they may feel reluctant to seek help. Symptoms of depression may be different or less obvious in older adults, such as memory difficulties or personality changes, physical aches or pain, fatigue, loss of appetite, sleep problems or loss of interest in sex not caused by a medical condition or medication, often wanting to stay at home rather than going out to socialize or doing new things, suicidal thinking or feelings, especially in older men. Depression is the leading cause of disease-related disability in women. Epidemiological studies have shown that the lifetime prevalence of a major depressive disorder in women, 21.3%, is almost twice that in men, 12.7%. This ratio has been documented in different countries and ethnic groups. Sex differences relating to depression vary with age, with male and female children showing similar incidence rates. National comorbidity data reveal that sex difference in prevalence first appear around the age of 10 years and persist until midlife, after which they disappear. Therefore, women have the greatest risk for developing depressive disorders during their children-bearing years. Several biological processes are thought to be involved in the predisposition of women to depression, including genetically determined vulnerability, hormonal fluctuations related to various aspects of reproductive function, and an undue sensitivity to such hormonal fluctuations in brain systems that mediate depressive states. Psychological events such as role stress, victimization, sex-specific socialization, internalization coping style, and disadvantaged social status have all been considered to be contributors to the increased vulnerability of women to depression. Women are more susceptible than men to stress-inclined depression and to changes in photoperiod. More than 80% of individuals with personal affective disorder are women. Depression in women may develop during different phases of the reproductive cycle: premenstrual dysphonic disorder, depression during pregnancy, postpartum depressive conditions, and menopausal depression. Other reproductive events such as infertility, miscarriage, oral contraceptives, and hormone replacement treatment have been reported to cause depression in women. If you feel depressed, make an appointment to see your doctor or mental health professional as soon as you can. If you're reluctant to seek treatment, talk to a friend or loved one, any healthcare professional, a faith leader, or someone else you trust. Befrienders Kenya is a charitable organization focusing on suicidal prevention by offering free emotional support to those who may be in distress and therefore in danger of dying by suicide, as well as creating awareness on suicide within communities. The organization focuses on suicide prevention. The services are run by volunteers and sustained through donations from well-wishers. In July 2020, a task force on mental health recommended that mental illness be declared a national emergency of epidemic proportions to prioritize mental health as a priority health and socio-economic agenda. The task force also recommended the establishment of a mental health commission and happiness to advise, coordinate, and continuously monitor the status of mental health, a report on the annual national happiness. The task force was inaugurated on 11th December 2019 and comprised of a multi-sectoral team from the Ministry of Health and other agencies under the leadership of Dr. Frank Njenga. The key findings of the task force indicated that Kenya has a high burden of mental illness due to ill health, psychological disability, and premature mortality with huge gaps in access to care. IBS, in full irritable bowel syndrome, can be caused by anxiety or depression. The Department of Gastroenterology and Hepatology at Singapore General Hospital explained the symptoms and risk factors of IBS is strongly linked to physiological disorders such as anxiety and depression. As far as scientists know, irritable bowel syndrome doesn't cause IBS, but for many people, the two go together. Sometimes one condition can make the other one worse. IBS is a type of functional gastrointestinal disorder, GI disorder. These conditions, also called disorders of the gut-brain interaction, have to do with problems in how your gut and brain work together. Symptoms. IBS doesn't damage your digestive tract or raise your risk for colon cancer. You can often control symptoms through diet and lifestyle changes. IBS is a group of symptoms that affect your digestive system. It's a common but uncomfortable gastrointestinal disorder. People with IBS get excessive gas, abdominal pain, and cramps. These problems cause your digestive tract to be very sensitive. They also change how your bowel muscles contract. The result is abdominal pain, diarrhea, and constipation. Researchers categorize IBS based on the type of bowel movement problems you have. The kind of IBS can affect your treatment. Researchers categorize IBS based on the type of bowel movement problems you have. Researchers categorize IBS on the type of bowel movement problems you have. The kind of IBS can affect your treatment. Certain medicines only work for certain types of IBS. Often, people with IBS have normal bowel movements some days and abnormal ones on other days. The type of IBS you have depends on the abnormal bowel movements you experience. IBS with constipation, IBS-C. Most of your feces is hard and lumpy. IBS with diarrhea, IBS-D. Most of your feces is loose and watery. IBS with mixed bowel habits. IBS-M. You have both hard and lumpy bowel movements and loose and watery movements on the same day. Majority of Kenyans associate mental health and mental illness with negative narratives, leading to low focus on the importance and benefits of mental health and well-being, the report says. The contents of the report were revealed by the Cabinet Secretary for Health, Mutahi Kagwe, after the conducted by the task force team at Afya House. The rising number of mental health related cases in the country, such as depression and other mental illness, some of which ended up in suicide cases, have been a concern to the government, Mutai said. His Excellency the President ordered the formation of the task force with the primary mandate to study the status of mental health in the country and recommend solutions to reform mental health systems. In Kenya, it is estimated that 1 in every 10 people suffer from a common mental disorder. The number increases to 1 in every 4 people among patients attending routine outpatient services. Depression and anxiety disorders are the leading mental illness diagnosed in Kenya, followed by substance use disorders. Among the different types of substances, alcohol contributes to the largest burden of substances use related illness in Kenya. Of great concern, alcohol abuse is prevalent in the 18 to 29-year-old age group. Advancing understanding of female depression will require future epidemiological. Advancing understanding of female depression will require advancing understanding of female depression. Advancing understanding of female depression will require future epidemiologic research. Advancing understanding of female depression will require future epidemiologic research to focus on, first, onsets and to follow incident cohorts of young people through the pubertal transition into young adulthood, with fine-grained measures of both sex hormones and gender-reported environmental experiences. Experimental interventions aimed at primary prevention by jointly putative biological and environmental risk factors will likely be needed to adjudicate between contending causal hypotheses regarding the separated